Hello everyone. In this presentation, our group will be discussing the importance of the 10 essential public health services in reference to a particular public health issue. Let's get started. In accordance with our Healthy People 2020 objective of educational and community-based programs, we chose to discuss school-based interventions for improving contraceptive use in adolescents. According to the CDC's 2019 U.S. High School Risk Behavior Survey, approximately 27.4% of students declared themselves sexually active. Of these students, 45.7% admitted to not using a condom during previous sexual intercourse, while 69.1% admitted to not using birth control. In fact, 11.9% failed to use any method to prevent pregnancy whatsoever. In addition to this, 90.6% of sexually active high school students have yet to be tested for HIV, while 91.4% had not been tested for other STDs during the previous 12 months. Hence, many students are actively having sex, abstaining from contraceptive use, and aren't being tested for STDs. This is a public health dilemma that we can and we should target through these public health services. The first service is monitoring health, in which the community continually assesses health trends in order to address community needs. This means instituting or using an existing clinical database that keeps record of admitted adolescent pregnancies that are determined unplanned, as well as diagnosed STDs in adolescents. In this way, we could determine the extent to which students are suffering from lack of contraceptive use. Also, we could implement biannual surveys focusing solely on sexual health in high schools and, as much as I hate to say it, maybe even middle schools. In this way, we could ask about sexual activity and contraceptive use, along with negative experiences with sex in terms of unplanned pregnancies and STD contractions. By these two methods, we can see where local adolescents stand in their sexual health and safety. From here, we can then diagnose and investigate what is barring adolescents from using contraceptives. First and foremost, it is wildly important that we constantly collaborate with clinicians and school officials, such as counselors. These professionals talk to students consistently, so their insight is key. Also, determining the environments in which these sexual acts occurred will help to investigate whether they were willful or forced encounters, in which we then decide whether this is solely a health issue or a criminal one as well. Assuming it's a health issue, we could then assess the sexual health education and access to contraceptives within the student population. These issues would tell us whether students were uninformed of safe options or whether they lacked the means to be safe. From such answers, we could move forward in bridging these gaps.
Inform, educate, and empower. This health service focuses on many ways to spread awareness of health issues and problems. They do so by implementing different methods and sources to prevent different kinds of health issues from developing. In order to provide awareness of the lack of contraceptive use in adolescents, implement presentations and guest lectures within high schools to explain the negative consequences of the lack of contraceptive use and what solutions to take to prevent it from further being a problem. Other ways to inform, educate, and empower on the use of contraceptives is to have a comprehensive communication plan, especially in high schools, as well as conducting community outreach through a variety of means such as advertisements, public meetings, and social media. Mobilize community partnerships and action. This health service is vital in identifying and solving health problems at a local level. They can have formal and informal partnerships to promote health improvement. When a community mobilizes, they become aware of the current lack of contraceptive use in adolescents and decide to take action, and by doing so, they can partner up with certain schools and companies that provide contraceptives to create a plan of action towards making a change in the lack of contraceptive use in adolescents. And having programs that help young men and women understand sex education can give them a better idea of what the negative consequences are of not having contraceptives, and also having easy access to contraceptives allows them to have it when they need it.
The fifth essential public health service is to develop policies and plans. This means creating laws, programs, and more to support individual and community health efforts. According to the American College of Obstetricians and Gynecologists, comprehensive sexuality education programs, clinic-based programs, school-based health centers, and condom availability programs have all been cited as potential contributors to decreases in adolescent pregnancy. Teaching young people more information about sex education has been proven to increase contraceptive use and improve sexual health of adolescents. Unfortunately, fewer than half of all states mandate sexuality education, and even in states that do have a mandate, the content varies significantly by county and school. Abstinence-only sex education, a common practice in many states, only results in teens not knowing their options for birth control and sexually transmitted disease prevention, increasing frequency of disease and unwanted pregnancy. Results improve even more with school-based health centers. School-based health centers that also supply contraceptives are well situated to provide convenient, confidential care to males and females. Studies show that such centers do not increase student sexual activity and may increase the use of contraception among students. One example of this is in Colorado, where they increased sex education and created laws to promote easier access to birth control, making it very cheap or free. This was successful as they experienced a 10% drop in abortion rates. Classes, as well as things like social media campaigns spreading information, will destigmatize sexual health conversations, improving contraceptive use in adolescents. The sixth essential public health service is to enforce laws and regulations. The purpose of this is to protect health and ensure safety. Colorado's policies are, again, a perfect example of this. As seen in Colorado, making birth control easier to access and increased education lowered abortion and unwanted pregnancy rates, improving the health and lives of women and teens. Governments and public health agencies must continually ensure the most accurate and relevant information is shared in schools and communities. Schools or teachers refusing to share information about health with students should not be tolerated. Additionally, they must work to keep sexual health and contraceptive-related laws in place or to improve them.
For the essential service of link to services and assure provision of services, one of the goals of that service is to enable equitable access to services and care needed to be like a healthy human, and for that to pertain to our topic, you could expand upon schools' availability of sexual education classes, making it standardized classes with standardized tests, and instead of it being like a one-day thing, it'd be a lot more in-depth, and youth would be a lot more informed about it. So for the essential service of assuring a competent public and personal workforce, the main goal of that is to build and support a diverse and skilled public health workforce, and how that would pertain to improving contraceptive use. You would have the teachers in sexual education classes be very intelligible and well-suited to teaching such a class, and being patient with students, because it is kind of a weird subject for students like that, and make sure that the teachers are competent and good at what they're doing.
The ninth essential public health service is evaluate effectiveness, accessibility, and quality. The purpose of this service is to basically evaluate the methods of treatment and prevention based on how successful they were against the health problem. So essentially, it is measuring the success rate of the methods used. You can do this through comparing data before and after the problem-solving methods are put in place, such as comparing the number of teen pregnancies and abortions before implementing contraceptive seminars, condom dispensers, more affordable access to birth control, and other things like that, to the numbers of teen pregnancy and abortions after implementing them. You can also compare the number of sexually active teens after taking a sex ed class to those who did not take a sex ed class at all. These comparisons should indicate how effective these methods are at preventing unwanted teen pregnancies and abortions. It could also indicate the quality of the contraceptives used. You must also evaluate how accessible these contraceptives are to teens and young adults. This can be done by taking a survey around schools and communities about how much access they have to the use of contraceptives and sexual education. When coming up with methods to solve a health problem, you must always evaluate how effective they are and how well people have access to them. The 10th essential health service is research. The purpose of this service is basically to gain more knowledge of the health problem they are dealing with in order to be able to better understand it so that better ways can be found to prevent or treat the problem in the future, such as researching ways to make contraceptives more effective than they already are and ways to make them more accessible to teens and young adults. Research like this has been done on contraceptives such as birth control. Health companies have now researched and developed birth control implants that last for 3 years and are more effective than regular birth control pills. This also takes away the risk of women forgetting to take their birth control pill regularly. Research takes place on contraceptives like developing better condoms as well to decrease the chance of them breaking and making them more preventative against STDs. Research is also needed to find better ways to promote contraceptive use and gain new knowledge about how to practice safe sex, as well as how to educate others to practice safe sex. Research of health problems will always be needed because there is always more room to improve and issues are always evolving.
Thank you so much for listening to our video. These are a few of the sites that we use to gather some of our information, but hopefully we brought some light to this very important issue and gave some practical ways that it can be addressed as a community. Thank you so much.